Hi, welcome to the fourth video in our series about COVID-19. If you haven't already, make sure to check out videos 1, 2, and 3. Today we will be talking about symptoms, diagnosis, and treatment of COVID-19. Symptoms. The symptoms you will have heard about by now are cough, fever, and dyspnea, i.e. shortness of breath. Other, less famous but common symptoms are fatigue, muscle pain, sore throat, diminished appetite, and sputum production, which are basically side effects of fever and cough. Occasionally, people will have diarrhea, nausea, vomiting, and a runny nose, as well as chest pain, headache, and coughing up blood. In rare cases, patients will present with pneumonia. Symptoms of severe pneumonia that cause great concern are a blood oxygen of less than or equal to 93%, respiratory rate of greater than 30 breaths per minute, and respiratory distress in general. Diagnosis. To count as a suspected case, you must have an acute respiratory illness and have come into contact with a probable or confirmed case in the last 2 weeks prior to symptoms, or have severe acute respiratory distress requiring hospitalization that is not explained by another cause. A probable case is a suspected case where testing came back as inconclusive, and a confirmed case, pretty obviously, is where testing came back positive. To count as a confirmed case, you do not need to have any of the symptoms or signs that we just mentioned. Serological tests are currently in development and might be more widely available than the tests they currently have. A US company has just developed a home COVID-19 test, which might be an option for people who don't mind spending hundreds of dollars on it. Treatment. What happens if you become infected? For most people, not a lot. In a case of mild infection, the only action you need to take is to isolate yourself. This isn't for your benefit, this is so you don't infect others who may not be as fortunate as to have a mild case. In a severe case, high-flow oxygen or mechanical ventilation using positive end expiratory pressure may be used, as will antivirals, although there are none specific to COVID-19 as of yet. All the limited antiviral drugs on the market are fair game in the search for a temporary cure, and they all target part of the virus reproduction cycle. The Ebola drug remdesivir in particular is very promising. It proves to be pretty effective for SARS and MERS, and possibly for COVID-19 as well. Apart from antivirals, interferon beta, a cytokine that's part of the lung's natural defense system against viruses, might be able to help the body launch a more effective attack on the virus. Best of all, it can be administered via inhalation, so it can directly act on your lungs where the viruses are reproducing most quickly. Until we get a vaccine or an antiviral ready, most people have to depend on their own immune system to fight off this novel virus, and its amazing memory for immunity. That's all for today, folks. Thanks for watching. Please make sure you like, comment, and subscribe if you enjoyed the video.